Hey everyone, it's Mike. I'm going to talk a little bit today about something that maybe seems pretty straightforward, but can be a bit tricky, and there are some considerations. I'm going to talk to you a little bit about how do you, as the primary care provider or a support staff person or practice manager, how do you talk to patients about the BHC? So before we dive into that, I just want to review the primary care behavioral health model, which is what we're trying to build here. We do that with this GATHER acronym. So G stands for generalist. Long story short, BHCs are generalists just like primary care providers. We want to try to help you with anything and everything. A stands for accessibility. This is to you as well as to your patients. So on your end, please reach out to us through any means of communication. If you need help trying to figure out the best way to get a hold of us, please talk to me, talk to your practice manager, we'll figure it out. In terms of patients, we want to be available to them on demand. So when you identify a need, ideally, as much as possible, we're helping out right then and there rather than scheduling them out. So T stands for team-based. That's pretty basic. You know, our job is to help you and to be part of the team. And everything we do, we want it to be team-based, coordinated, collaborative, etc. High stands for high volume. You know, so again, we're just like you. We want to use brief targeted visits and hit as large a portion of the population as possible. E stands for educator. Basically, this means that we're not only there to see patients, we're also there, again, as part of the team to try to improve the entire team's ability to manage behaviorally influenced conditions and issues. And so if you have any questions about anything, if you want to try something out that you saw us do once, please let us know. We'll give you feedback. We can educate you, whatever you need to do. And R stands for routine, and this is a key one for the topic we're talking about today. We want to present in everything we say, everything we do, that this integrated model is just normal healthcare. This is the only way we would ever think of doing it. Okay, so you know the bottom line with all of this is that we are primary care providers. You know, we want to do as primary care does. The more that basic premise kind of sinks in for you, the more all of this other stuff will just automatically make sense. Okay, so some general considerations on when you are talking to patients about the BHC. First off, just keep in mind your patients trust you. You know, they're there to have you take care of them, to tell them what they need to do to get better. This is something to really be aware of when you're talking about the BHC. You know, if you can kind of make use of that, your rapport, the trust you have with the patient, it can kind of rub off on us, the BHCs, a little bit and help us dive into things with the patient that much more, build a relationship that's similar to the one you have that much more quickly. Secondly, just keep in mind, patients may be a little thrown off when you bring up the BHC, and you know, there are a lot of good reasons for that. There's a lot of stigma in our country around mental health, right? So they may be a little confused about why we're needed. They may even be a little bit upset, you know, like, wow, you think I'm crazy, or you think this is all in my head, you know, those kind of classic things. I see this as a great opportunity for a corrective learning experience. You know, if we're able to present this as routine and as critical to their care, we can really kind of start to change that a little bit. I don't expect you to do a lot of kind of heavy lifting in terms of talking all that out with the patient. All we really need for you to do is to just, in what you do and say, convey how much you value the BHC, how important you think it is for the patient's care, and then we can kind of take it from there. Finally, you know, it may be the opposite. Patients may be really excited to see us. You know, there is that stigma, but more generally, there are just a lot of preconceived notions about mental health. This is a new way of doing things, right? So a patient may have this amazing experience of having seen this therapist for 7 years, you know, every week for an hour. And they talked about everything in their life, and it was wonderful. And that's fantastic. You know, I'm so glad that they had that experience. That being said, the BHC is probably not going to be doing something like that. You know, if the patient has those kinds of expectations, they may be very disappointed. So we need to know how to handle that as well. Lastly, just be kind to yourself. I threw that in there because All of these things I'm talking about to do or not do here and on the following slides, you've probably done all of them a bunch of times. I still do it sometimes. Those preconceived notions and stigma and things are built into our brains too. And it's going to be an iterative process over time to kind of shift that. So again, just be patient, be kind. Okay, so one of the main things that we want to think about and be mindful of when we're talking to patients about the BHC is the words that we use and the tone that we're using when we use them. So I talked about that stigma associated with mental health. I talked about those preconceived notions. Those things are gonna most likely be triggered on the patient end by the words we use. So we want to avoid certain terminology associated with traditional mental health. So try not to talk about counseling, therapy, counselor, therapist, social worker, psychologist, psych issues, those sorts of things are automatically, a patient hears that and their brain's going to go straight to whatever experiences they've had or things they've heard about traditional mental health, which again may be unhelpful to us, whether it's a positive or negative association for them. So ideally, just call us the BHC, Behavioral Health Consultants. Other things that are totally fine would be behavioral health provider, team member, colleague, or you could be really specific. They're our expert on diabetes self-management, things like that. Kind of along those lines too, when you're describing what we do, try to avoid mental health specific terms. So talk about stress management, healthy living, behavior change, habit change, lifestyle, things like that. Or again, just be very specific to whatever you want us to help with. I have them help all of my patients. They're experts on managing your insomnia, things like that. Try to avoid talking about things related to like visit length, visit frequency, stuff like that, where there's a difference between what they may have experienced in traditional mental health versus what we do. If a patient asks, well, I used to see my counselor every week and I need to see my counselor every week. Can they do that? Try to just punt that to us, and we can handle that. A big exception to this would be if a patient's kind of like balking at the referral. You do want to highlight the flexibility and the accessibility of the BHC. So it's perfectly more than fine to say, you may only need to see them the one time. There's not going to be a big commitment here necessarily. You can say, oh, you've only got 13 minutes. That's fine. The BHC will see you for 13 minutes. They try to work with you. Those types of things are good, not things to avoid. And this last thing here, be careful not to set yourself up for patient refusal. Mainly what I'm talking about there is your tone and how you approach talking about it. So again, we have that stigma and preconceived notions built into us too. And one of the ways that plays out for us as providers or support staff or whoever is that we may kind of predict in our own minds without realizing it how the patient is going to respond. And so what that might look like is if you are kind of going to the patient saying, well, we have this guy here. He might be able to help you with this. Would it be okay if I had you see him? I'm exaggerating a little, but obviously, a patient's going to be like, oh, they're thinking I'm, not going to want to see this person. Maybe I don't want to see this person. So again, just be careful about that. Okay, so I hit on this a little already, so I'll kind of go through it a little more quickly. Try to be specific when you're talking to patients about the BHC. So things you want to avoid are like, I think you need CBT. She'll treat your mental health. He'll help you be more compliant. That's pretty broad. We want to kind of be specific here. So they'll teach you skills to help you do what's important to you, even when you feel anxious. Managing blood sugar is hard. She can help you find ways to do that work in your busy life. And try to focus on functioning behaviors rather than feelings. There's a lot that goes into that concept that I'm not going to talk about today, but it is important. So, for example, don't say things like, they can help you feel better. Oh, they'll help you talk all this out. They'll help you process this. Try instead to focus on behavior. So they'll help you come up with a plan to quit smoking. They'll help you develop a sleep routine that's healthy but also works for you. Things like that. So we talked in the beginning about the BHC as a team member and how important that is. We really want to emphasize that when we're talking to patients about the BHC. So try to use wording like, she'll help me help you. I have the BHC see all of my patients with XYZ. That really normalizes it, and it really shows that we're a team and that you're not going anywhere. So highlight collaboration and coordination between the PCP and the BHC. So I wrote an example out there. I'll fill them in and let you know what I need their help with. After their visit with you, they'll talk to me about any plans the two of you made, and they'll give me recommendations if there's anything I can do to take better care of you. So there's a lot of stuff implicit in there, right? You are emphasizing that you are still very much involved in the patient's care. You're emphasizing that the BHC is helping you take care of the patient as their primary care provider. And more generally, you're just highlighting that the two of you are working together as a team. Finally, I kind of just hit on this, but if you need to, if you're sensing that hesitation, if you think the patient is worrying that you're punting them, reassure them that you're not doing that. So for example, schedule a follow-up with me about a month after you've seen the BHC so we can see how things are going, and so I can review what I learned after talking about your needs with the BHC. So again, makes it very clear that you're not going anywhere, that you are making use of the BHC to help you take better care of the patient. So in the beginning, we also talked about the importance of conveying BHC services as a routine part of care and as a very important, crucial part of care. You basically want to act as if you couldn't possibly think of any other way of treating the patient, that's kind of just the obvious thing to do. I hit on this a little before, but I'm going to emphasize it again here. You don't want to beat around the bush. I tell my providers to not even ask for permission when they're referring to the BHC. You want to treat it the same way you would anything else. I mean, do you ask them if it's okay to get lab work? No, you just let them know, hey, we need to get some lab work. We kind of want to present the BHC the same way. Now, of course, if a patient refuses when you do that, you want to respect patient's autonomy. But again, even asking the question kind of implies that maybe this is something they shouldn't do. So just keep that part in mind. Again, we want to normalize the referral. So I have all my patients with X, Secura. Dr. Bronstein and I work together on many of my patients every day. We just want to make that a normal thing. And again, convey the importance. So a couple examples there. I think getting Dr. Bruner's thoughts is the most important thing I can do today to help you. That's a pretty powerful statement. Frankly, I don't see us getting a good handle on this without the BHC's help. That kind of phrasing really kind of shows the patient, hey, this is important. This is something we need to do. So this part can be a little tricky because we certainly don't want to throw traditional mental health services under the bus. There are those patients that need counseling or therapy. It's an important part of our healthcare system. That being said, for some people, there may be aspects of an experience with traditional mental health that they perceive as negative. It's something that they don't want to repeat. Or maybe just don't need right now. If something specific comes up like that on the patient end, we want to address it by highlighting how the BHC will not be that way. So again, we want to be clear that the visits are often brief, that the patient also may be able to see the BHC right away, maybe even before they leave the office. We want to emphasize the benefits of the collaboration between the PCP and the BHC. That's probably something that did not happen if they had counseling or therapy in the past. We want to emphasize that BHC visits are patient driven. They're really the boss in the visit. You may be sending us in for a specific reason, but part of the BHC's job is to kind of meld that with whatever's important to the patient and try to find common ground there. Some of these things that I'm talking about that we want to especially try to avoid, but know how to talk about correctly if it comes up. If the patient says, oh, I don't know, like I did therapy before and we just kind of talked about my last week, we didn't do anything. You can kind of say, well, they certainly will talk to you, they will listen, but their main goal is to help you do the things that are important to you. A patient may say, oh, I don't know, I don't have an hour. If they say something like that, you can say, actually, hey, it's great that you don't want to be here for an hour. BHC visits are often only 20 minutes long. If a patient says, I don't think I need weekly therapy like I did in the past, I'm doing better than I was back then, something like that, you could say, well, you don't have to see the BHC every week. In fact, a lot of people only see the BHC once and they're kind of good to go. Okay, so this one is just a few frequently asked questions, things patients will often say or ask that I haven't hit on kind of all together here, and I figured I'd just give you an example of how I might address that question from the patient. So the first one, what does he do, or what happens in a visit? So you could say, well, first, they'll get a quick snapshot of your life, and specifically how the problem impacts it. Then they'll usually do some education to help you understand what's happening a little bit better, and they'll do a gut check with you to make sure that sounds right. Once they've done that, the most important part is that the two of you will work together to create an action plan to do something differently. They may teach you a skill to practice or maybe do some problem solving with you. So another one, I'm already seeing a counselor. Why do I need to do this? So a way you might respond to that is, well, Dr. Bruner may seem to have some similarities to a counselor, but he works a lot more like I do as a primary care provider. It's great that you're seeing a counselor and I encourage you to continue, but I bet they aren't helping you with XYZ. Also, your counselor doesn't really coordinate with me, whereas Dr. Bruner is on my team and he'll specifically help me help you with XYZ. So this last one, I have talked about this a bit. Are you saying I'm crazy? Or so you think this is all in my head? Or you want me to see a shrink? Something like that. So you could respond to that this way. Not at all. Actually, I think the fact that you're struggling with XYZ is a perfect example of you being a normal person. We don't think of things just being in someone's head anymore. What we do know, though, is that every health problem impacts how a person thinks, feels, and behaves, and vice versa. So I ask Kira to help me with many of my patients all the time for all sorts of things. She can help me help you make changes that will not only improve your health, but will also help you feel like you're being the person you want to be. Okay, so just a few final thoughts. First, handle referral to the BHC the same way you would any other referral. Treat it like you're referring to a cardiologist, endocrinologist, whatever. You'll probably do fine if you think of it that way. Secondly, remember, the BHC is a primary care provider and does as primary care does. Finally, ultimately just reinforce the patient's autonomy in choosing their care. In other words, if they refuse to see the BHC, respect that. If you can talk with them for a little bit and figure out what it is that's holding them back, you might be able to address it, in which case that's great. Another thing you can try if they don't want to do a visit is you can kind of say, well, that's fine. If you don't want to do a visit today, no problem. I will let the BHC know. But I do want them to come in and just say hi to you so that you know their face, because we may need them later. If you think you can get away with that, go for it. A lot of times, if we can get our foot in the door, a lot of those preconceived notions and things, a lot of that defensiveness just kind of breaks down, and the patient will often want to see us actually. But if not, that's okay. We don't want to create like a negative kind of association with the BHC. If they refuse today, no problem. They may say yes tomorrow. So I think that's it. If anyone has any questions, comments, concerns, please don't hesitate to reach out. Your BHC can kind of walk you through any of this anytime. Thanks very much. Have a good one.